Carpal tunnel syndrome is one of the most common nerve compression disorders of the upper limb. In fact, millions of people each year. But people may not realize that the discomfort they are having is from carpal tunnel syndrome. Hi, my name is Dr. Marc Gruner. I'm a board-certified sports medicine physician. Carpal tunnel syndrome is one of the most common conditions that I treat in my practice. So what is carpal tunnel and how do you know if you have it? Carpal tunnel syndrome happens when the median nerve, this nerve runs through your forearm through a narrow passage in your wrist and can be constricted by a ligament that is located at the wrist. This nerve controls movements in part of your hand, like your thumb, your index finger, and your middle finger, and part of your ring finger. When the nerve is under pressure, it can cause numbness, tingling, or burning pain, especially those in the same fingers. People often describe this as pins and needles or an electric shock, feeling that it can even travel up and down the forearm. Symptoms are usually worse at night and may even wake you up from sleep. Some people will shake their hands or let them hang over the bed to get relief. During the day, your hand might fall asleep while driving, holding a phone, typically, or even gripping small objects. To help identify carpal tunnel syndrome, there are 2 simple screening tests that you can try at home, or that your doctor may do in the office. Remember, this video is for educational purposes only and is not a substitute for medical advice. Always see a doctor for the correct diagnosis. Let's start with the Phalen's test. Sit comfortably and rest your elbows on the table. Bring the back of your hands together in front of you so your wrists are bent and your fingers are pointing downward. Hold this position for up to 60 seconds. If you feel tingling or numbness in your thumb, index, middle, or ring finger, that could suggest carpal tunnel syndrome. You can rest your arms on a pillow if it's uncomfortable. The second test is the Tingle sign. During this test, your doctor lightly taps on the inside of your wrist where the median nerve that runs through your wrist can be constricted, which causes tingling or electric shock sensations shooting in your fingers. This test may be positive and suggests nerve irritation when you hit the wrist and it causes those symptoms. In more advanced cases, you might notice weakness in your thumb muscles or in your hand, and it might be harder to pinch or grasp other objects. Over time, the base of the thumb can even look flatter, a condition called thenar atrophy, flatness of the thumb. Now, who's at high risk for carpal tunnel syndrome? Women are 2 to 4 times more likely to develop it than men between ages 40 and 60. Hormonal and anatomical factors like small wrist spaces and fluid retention during pregnancy play a role. Repetitive wrist movements, awkward hand positions, obesity, diabetes, pregnancy, and inflammatory diseases like rheumatoid arthritis can all increase the risk. Age, smoking, and sedentary lifestyle can also contribute. What about the treatment of carpal tunnel syndrome? Carpal tunnel treatment depends on how severe your symptoms are. Most mild to moderate cases improve with non-surgical treatments. Start by adjusting your activities and improving your ergonomics. Avoid repetitive or prolonged wrist bending, and take short breaks every 30 to 60 minutes when typing or using your hand. Keep your wrist straight and relaxed, especially when you're typing. Wearing a wrist splint or brace, especially at night, can keep the wrist in a neutral position and reduce nerve compression. Nerve and tendon glide exercises can also help the nerve move more freely. Some of the exercises involve stretching your hand so your nerve can breathe a little bit more in the wrist. Over-the-counter anti-inflammatory medications may reduce pain and swelling. In some cases, doctors may recommend steroid injections for temporary relief. If symptoms persist beyond 4 to 6 months or cause significant weakness, carpal tunnel release surgery may be necessary to relieve the pressure on the wrist and free up the median nerve, which is causing the numbness, tingling in the hand. This can be done through open, endoscopic, or newer ultrasound-guided carpal tunnel techniques. Carpal tunnel syndrome can be frustrating, but is highly treatable, especially when caught early. Pay attention to the first signs like nighttime tingling or numbness can help prevent long-term nerve damage and preserve hand strength and function. What questions do you have about carpal tunnel syndrome? Drop them in the comments below and I'll try to answer them in a future video. If you found this helpful, don't forget to like and subscribe. I'll see you in the next one.